I have headaches myself, which is one of the reasons I'm very passionate about treating headaches and seeing headache patients. It's not an arena a lot of doctors want to get involved in. It can be challenging, but through my own experiences, I've come to realize that you really need to study headaches. You really need to develop a program to approach headaches, and you really need to apply some expertise. There's a lot of armchair experts out there who will give you advice when you get a headache. Oh, take this, it always works for me, or my grandmother always told me to strap a poultice on my head and that'd work great. And if those things work, that's fine, but I know in my own case, I've had headaches since I was 5 or 6 years old, and they were misdiagnosed as sinus problems and dental problems and eyeglass problems. And in fact, this persisted right through college and medical school. Nobody picked up on the idea that I had migraine headaches. It wasn't until I was in a neurology residency program at the University of Oklahoma, and the director of the program was the president of the American Headache Society and a member on the board of the International Headache Society. And he pointed out to me, he said, "Dana, the headaches that you're having meet all the criteria for migraine headaches." And then a light bulb went off, and I said, wait a minute, if that's true, I've been treating my headaches all wrong all this time, throwing over-the-counter medications at the headaches when actually there are much better prescription medications. And I've been doing things such as sleep deprivation and too much caffeine that would trigger migraines that I needed to modify. So once I knew the diagnosis, then I knew a logical approach to address my headaches, and now I'm in charge of my headaches instead of the other way around. And migraines are not the only type of headache people experience, but they're by far the most common. In fact, of all people who go to see their doctor or go to an emergency room with the complaint, "I have a headache," over 90% of those individuals have migraines. None have sinus headaches. And very few have other types of headaches, such as exertional headaches, trigeminal vascular headaches, cluster headaches, and so forth.